Good morning, everyone, and welcome to today's Office of Community Living Update webinar. My name is Jennifer Larson, and I'm the training coordinator for the Office of Community Living. Just as a reminder, we are recording with the intent of posting this recording on our website, so please be cognizant of sharing any personal or protected health information, either verbally or in the chat throughout the meeting. Our team is managing questions in the chat panel, so please type those in as you have them, and we'll have responses coming in through there. You can get a copy of today's slides. They are available on our website, and we will add a link to those in the chat for you so that you can go out there and grab a copy for yourself. If you are listening by phone only and not in the video portion of the meeting, you can still participate by pressing *6 to mute and unmute your phone, or press *9 to raise and lower your hand so you can be added to the queue. And Zoom does provide closed captioning. If you click on the live transcript button or CC button at the bottom of your screen, you can turn that either on or off. And with that, I will turn it over to Colin to start us off.
Great, thank you, Jen. Good morning, everyone. On this snowy spring forward week, I think it never fails. We lose an hour of sleep, and it's getting nicer, and then it snows. So with that, thank you for joining us. We've got a busy agenda today. I am actually going to turn it over to Julie Riskin, who's going to help moderate today. We do have several guest speakers this morning, so wanting to make sure we give them enough time, and then we'll go through some additional things at the end. But Julie, if you want to take it over, that would be great.
Sure. Good morning, everyone, and thank you for participating. It's, I think, really important that our community gets to know what's going on and has a number of ways to be able to do that. And this is one of those ways. I commented to Colin that I was very impressed that they only had 36 slides, because in the past they've been a little more, and he said that they were practicing restraint in 2023. So we'll hold them to it in upcoming meetings. The first person who's presenting is to talk about Developmental Disabilities Awareness Month. So Ellen Jensby is from Alliance, and Ellen, if you could come off mute and tell us about this month, that would be awesome.
Yeah, absolutely. Thank you, Julie. And hello to everyone. Thanks to HCBS for allowing us just a couple of minutes to highlight some activities around Developmental Disabilities Awareness Month. I sent some slides, so I'm not sure if there might be one next. There, perfect. So of course, this has been an annual event since 1987, when President Ronald Reagan first proclaimed March as National Developmental Disabilities Awareness Month. And it's, of course, designed to raise awareness about the inclusion of people with developmental disabilities and all aspects of life, as well as the barriers that people with disabilities in general still sometimes face in doing that. So I put the artwork that's been selected for 2023's Developmental Disabilities Awareness Month there on the right. And the national partners who engage in that work selected the theme of Beyond the Conversation. So I'm sure Google can give you some more information if you want to dig in a little bit more on that. But here in Colorado, if you'll move to the next slide, Celebration has been underway. And what's not on this slide is that we kicked off the month with an event at the Capitol. It was the first annual Disability Rights Advocacy Day, hosted by a number of people who are on the call, and I'm sure many of you were there in person. While I wasn't able to attend in person, I heard it was a big success, and so I'm sure it'll become an annual event. And then at the end of the month, we love how these two events have kind of bookended the month of March with disability awareness at the Colorado Capitol. So on the 29th, we'll have Intellectual and Developmental Disabilities Awareness Day. There are in-person as well as virtual options to attend this. So we'll kick off the day at 9 a.m. with the Pledge of Allegiance in both chambers, led by someone with lived experience with IDD. And each chamber will also have a tribute. We don't know exactly what time they'll read those tributes, but hopefully between 9 and 10 a.m. At 10 a.m., we will stream live a policy webinar hosted by the 3 partners of this day. Of course, us at Alliance, the ARC of Colorado, and JFK Partners, to highlight some of the bills and budget items to keep an eye on this year at the legislature. You can get the links to that at our webpage that's there at the bottom of the slide. And then at noon, we'll have the virtual luncheon and speeches, including announcement of the 2023 Direct Support Professional of the Year Award. Again, the links to watch that live will be at the webpage you see there on the screen. And if you'd like to find out more details and more activities that are happening that day, please go to that webpage and join us as we try to bring awareness and close out Developmental Disabilities Awareness Month on the 29th. And then finally, just a quick plug, if you move to the next slide. At Alliance, we're really excited this year to be celebrating our 50th anniversary as an association. So on mainly June 23rd, but also the 24th, we'll have several events to commemorate our 50th anniversary. The first is our event at the Denver Zoo on the afternoon of the 23rd. We are frantically working on putting together all the details of that exciting event. And we hope many of you will join us there. And then we annually do awareness events at our state's local sporting teams. And so that evening we'll have our IDD Community Awareness event at the Colorado Rockies. Usually we schedule that at a fireworks game, so it's a fun time. And then the following day, we'll have an event at the Colorado Rapids. So if you're a sports fan, please join us. You can get discounted tickets, and all the information for those events can be found at the website listed at the top of the screen. That's all for me. Thanks for your time.
Thanks, Helen. We appreciate it. So speaking of awareness months, I'd like to ask Kate Kirkmans from the Brain Injury Alliance of Colorado to talk about Brain Injury Awareness Month, which is also apparently in March.
Thanks, Julie. Yeah. Hi, everybody. Thank you for having me. It was really nice to hear Ellen speak. I feel like our months are highly aligned, so that's great. So yes, March is also Brain Injury Awareness Month. My name is Kate Kirkmans. I'm the president and CEO of the Brain Injury Alliance of Colorado. Just wanted to take a few minutes to tell you all about our services and some things that we're up to these days. So if you're not familiar, the Brain Injury Alliance of Colorado serves the entire state. We are a 501c3 nonprofit established in the early, one second before we move on, in the early 1980s. So our services are for anyone with any kind of brain injury, both traumatic and non-traumatic, any age range. We provide resource navigation and facilitation. We provide skill building classes, skill building programs. We have classes and workshops, adaptive recreation programs. We have an annual conference. We have support groups all over the state. We have a mental health department, so we have certified brain injury specialists providing mental and behavioral health to folks, which we know is a big need, so we're happy to help fill that gap. We do work in the criminal justice population and many other populations that struggle with high rates of brain injury. One of those is the homeless population. So if you don't mind moving on to the next slide, please. I want to talk about one of our big projects at the moment. Is called Valor on the Facts. It's a 72-unit permanent supportive housing complex on East Colfax. Colfax and Trenton are the cross streets. We have 1, 2, and 3 bedroom units, and we are set to have our first resident moving in next week. This project has been about 4 years in the making, and so we are really thrilled to be opening our doors. The Brain Injury Alliance is going to be providing 24/7 services on site to residents, including all of those services I just mentioned. If you want to go on to the next slide, we can talk a little bit more about some details of the program. So all of the units are going to be fully furnished, 24/7 staffing. We have some beautiful outdoor space, communal space to help get folks together. And again, some of those services that I mentioned, that we'll be providing in the building as well, which we're really excited about. One of the really great aspects of this building that we hope is really going to set it apart is that the Brain Injury Alliance has been involved in the creation of this building from day one, which means we've been able to bring a trauma-informed lens to both the design of the building, how it's going to be implemented, how it's going to work. So everything from the architecture of the building down to the individual pieces of furniture that we're moving in are all trauma-informed design and care. So we're really excited about that. Plus, all of our staff are going to be certified brain injury specialists or trained in the unique needs of people with brain injury or related disabilities. So as I mentioned, that's going to be opening next week. So we are full steam ahead. It's a really exciting time to be providing those services to folks experiencing chronic homelessness. Next slide, just a couple of things that we have going on coming up soon. Last night, we actually had our first Dine Out to Donate. I was too bad that we didn't get to talk to you first, which was a great success. We're going to have another Dine Out to Donate on Thursday, March 30th at Sloan's Lake Tap and Burger. Anyone who comes can eat, drink, and a portion of the proceeds will come back to the Brain Injury Alliance. So feel free to join us for that. We have a really exciting opportunity coming up on Sunday, April 2nd. There is a documentary film. It's that middle photo there called The House We Lived In. It is about a family going through their experiences when the father has a traumatic brain injury and what it's been like for that family. And we're going to have a private screening of this documentary film at the Scythe Theater on Colfax. There'll be a little bit more details about tickets on the next slide, but hold off for just 1 second. And then on Tuesday, May 23rd, we have our annual golf tournament called Kathleen's Cause Golf Tournament at the gorgeous Arrowhead Golf Course. Tickets for that are also available on our website. And then just on my last slide, just to be extra easy, if anyone is interested in joining us for that movie, The House We Lived In, you can put your phone's camera up to the QR code there. Tickets are $22, so not terribly expensive. And we're looking forward to a really exciting impactful movie and an opportunity to get folks interested in brain injury and learning more together. Again, that's April 2nd. So that's everything we have going on. That is my, oh, thank you. So it's C, is that correct? Hopefully I got that right this time. I had never heard of it, but it's very popular and everyone seems to know about it but me. So thank you for helping me pronounce it correctly. That's all I have for today. Thank you so much for having me. Happy to answer any questions if there are any, and appreciate your time.
Thank you very much. I don't see anything in the chat, so we will plow forward with our fairly packed agenda. So case management is always something that we have updates on. And so there's a lot of different things going on. So Amanda Lofgren is going to talk to us about the different things that are happening immediately and that are not happening and that are happening in the near future. So Amanda.
Great, thanks, Julie. Good morning, everyone. I wanted to give an update to you all. Many of you have been working closely with us or following along on our new care and case management system. This is kind of phase one of 4 different phases to implementing a new IT infrastructure that allows the department to consolidate 3 existing systems for our case managers to create some efficiencies and some improved data collection and tracking of information that will then house our new assessment and support plan in the future, as well as the work around person-centered budget algorithms. And the first step in this is implementing the care and case management system. And we were supposed to go live this week, actually. But there was a couple things where the department felt that there was some outstanding risks that we needed to take some additional time to really slow down and make sure that we get it right for go live. And this includes our ability to have reporting functions working for the case management agencies to pull for billing, et cetera. The other piece that was a risk for us was data migration. So all of the data that exists in our current systems needs to be migrated over to the new system, which, as you can imagine, is an extraordinary lift. And so we found some defects that we needed to slow down and revisit how we're going to do that migration. And then we also have some defects in the system and really just want to make sure that we're able to remedy those and retest them and ensure the system is working as it needs to for the business needs. And then lastly, when we stand up the new system, we want to have a very comprehensive and well-trained call center operations. Case managers will be able to contact the call center. There will be 35 agents trained on the new system that can help them navigate, address login issues, any of those challenges that all of us experience when we use a new system. So with that, we made a decision to not go live this week. We are expecting it to go live somewhere in the middle of April, but we are working with our vendors to finalize that date, and we'll be communicating that in the coming week. So don't have that new date yet, but we'll be letting folks know in the coming week what that will be. So if we go to the next slide, the other piece of case management redesign is really changing the way that individuals access their case management through more of a consolidated and streamlined process. And so right now we have over 47 case management agencies, and depending on which waiver you are utilizing, you go to a different entity, whether it's a community center board or a single entry point, or even our private HCBS case managers. And so in order to do this, we have a competitive RFP that's out. We'll be having 20 case management agencies in the future serving all individuals for all waivers. And so the case management RFP proposals were due Tuesday, February 28th. The department's evaluation committee is currently reviewing all of the proposals. The department has determined that the procurement was failed in 2 of our service areas, which include our Chaffee Cluster, Fremont, and Lake counties, in addition to our Grand, Jackson, Moffett, Rio Blanco, and Routt counties. So because of this, we will have time to resolicit this work. The department intends to enter into competitive negotiations with interested vendors that submitted a proposal, as well as any new vendors that may be interested in serving those 2 areas. Interested parties that have already submitted a proposal, the department will be reaching out to let them know that they can bid on those 2 counties that didn't have any offerers. And so we also, because of all of this, the department program staff, myself, my team, we oftentimes get a lot of questions. And so we are asking that if there are any questions related to this RFP, they are sent to that. You can see the email link below here, the HCBS RFP questions inbox, because our procurement team really needs to be the one that responds to that, any questions that come in around that, just so that we make sure that program staff aren't giving information outside of the requirements that are part of our procurement process. So we're very excited about this. Notice of intent to awards will be communicated out at the end of May, first part of June, and transitions will begin August 1st. We'll have 3 cohorts transitioning. The first wave will start, as I mentioned, in August, and then in next spring, and the final cohort will be ready so that all agencies are in effect by next July 1st, which also allows the department to come into compliance with conflict-free case management. All right, so if we go to the next slide, we can talk about the public health emergencies ending, and we have a number of Appendix K that will also expire due to the PHE End. So the department was able to implement increased flexibilities during the COVID-19 pandemic, and some of those were unable to continue, but many of the flexibilities we were also able to continue. But the 2 that we're not able to, for case management specifically, are verbal authorization of signatures. So these will no longer be accepted starting November 11th of 2023. So we have several months to prepare and plan. I am happy to share, though, that digital signatures will continue to be accepted. It's just really the verbal piece that CMS will not allow the department to continue. The next area, virtual case management activities, will also end November 11th of 2023. Case managers will be required to perform the level of care screen, which is also referred oftentimes as the 100.2 assessment, and these will be required to be in person. The department is currently working with CMS to allow post-PHE virtual case management contacts with members. This is for our monitoring. And so we are working really hard to allow for virtual monitoring where CMS will allow us, but they have always communicated to us on the front end that the assessment and annual CSR will not be something that they would allow to be virtual. So we feel like we were able to kind of balance the needs of CMS with what we have heard loud and clear from many members and families during the PHE, that they did like having that virtual option. So the last piece of this is for case management agencies. We will be working with them on additional information for the closure process for members who are locked in because of the PHE and continuous enrollment. And so we will be issuing a memo as well as having a webinar in the coming months. So with that, I will turn it over to Colin for the benefits.
Great, thanks, Amanda. So just real quick, wanted to give background. Julie, thank you so much for highlighting what some of those acronyms are. Give background on what the Appendix K is real quick. So for those of you who may be new to this meeting or weren't following along as closely, or maybe just forgot because there's a lot of information around the end of the public health emergency, the Appendix K was a vehicle that the Centers for Medicare and Medicaid allowed states to use to put forward urgent matters related to home and community-based services. So the reason we call that an Appendix K, it fits within the waiver and it allows states to more quickly update things that they see in response to the COVID-19 pandemic. So for example, the state of Colorado, we actually put, I think at this point, over 40 different flexibilities as part of our Appendix K. And we're very happy to say that the vast majority of those are remaining. However, there are a few things that will be ending. A couple because we've heard responses from the community and members, providers, others who either the services and the flexibilities aren't being used, or the preference is to go back to the original method, the in-person method. And then a couple that I'll get to at the bottom there that are actually ending because federal regulation and corresponding statute do not allow them to be provided by certain individuals. So up top, what we're looking at right now is going to be 6 months beyond the actual end of the public health emergency itself, which ends in May. So we will not be looking at any of this ending until November 11th. There will be a big communication that I'll leave to my friend Mark Williams here in a moment to talk about that'll be going out. It will cover all of these in more detail, what that looks like, but we'll be working really closely with case managers, having them work with families on a lot of these things. But we do have an additional 6 months for these Appendix K. And so what will be ending at that point in time is our day treatment benefit, having a telehealth option, same thing with our pre-vocational services and our behavioral services, the line staff in particular, within the DD and SLS waivers. Now, the second part of this, we had allowed some flexibilities under the Appendix K that aren't normally allowed within, again, federal regulation under our home and community-based waivers. And that is for payments to be made for services that are provided by family caregivers or legally responsible adults. And so within the CES waiver, you have Community Connector and Homemaker. And then within CHIRP, you have supported community connections. Those three services will end, or the ability to have those provided by a family caregiver will end in November. And so again, there will be a lot of communications that go out about this. We'll be working very closely with case management, with families, trying to find those providers to backfill that. But that is something that, again, the federal government within the Centers of Medicare and Medicaid do not allow for states to be reimbursed with that as the service provider. So wanted to provide those updates, more details to come publicly. But again, that is not going to happen in May. It will happen in November, so we have a longer runway there. With that, I'm going to turn it over to Mark to talk a little bit about what happens when the continuous coverage ends here in Colorado.
Very good. Thank you, Colin, and good morning, everyone. It's a pleasure to be with you. My name is Mark Williams. I'm the Public Information Officer for the department, and our team has been busy at work cranking out all kinds of communications with regard to the end of the continuous coverage requirement. So I just wanted to touch on that a little bit with you. So Health First Colorado and the CHIP program are going to be returning to the normal renewal process with notices going out actually yesterday and today. The first notices are going out for those people whose renewal date comes up in May. It's important to note that we are not renewing all members all at the same time. There are a few states that are somehow going to try and take that on, and frankly, I wish them well because it is a heck of a lift. So what we will be doing is when a member's enrollment anniversary comes up, and it's based on when the member enrolled with Medicaid or CHIP, that's when their renewal will come up for review. And we will take a full 12 to 14 months when you factor in noticing to get that done, so that we can manage those cases effectively, not swamp our counties with a lot of calls and create frustration for members who can't get through, et cetera, et cetera. But so the first of those renewals are going out, like I said, yesterday, today, and probably tomorrow, with the first of them hitting mailboxes again for those May renewals, probably around the 20th. The deadline for renewal packets for members to fill out their renewal packets is to get them back to the department or the counties by the 5th of each month. And so we are encouraging the use of PEAK wherever possible, only because that will expedite a lot of that work, as well as avoid people sitting on hold waiting to speak with someone. All in all, we expect that about 30% of members will be auto-enrolled based on information we already have on file. And I think I said that right, 30% will be auto-renewed. Overall, we anticipate that 80% of the current enrollment will continue with coverage. It's that remaining balance that is estimated to be a little more than 325,000 people who are likely not to meet eligibility requirements going forward. So those are some rough numbers for you. If we could move to the next slide, please. So we have a number of communication resources that have been created to raise awareness that we have made available. We have also created kind of a one-stop shop website to at least get people in the front door, if you will. We've kind of gone back and forth on this as we've tried to figure out the best way to roll it out. We have some websites that are dedicated to stakeholder and community partner focused information. And then we have our Health First Colorado website that is more member focused. And as we were talking through this and doing, frankly, many of these types of presentations, we've discovered that it gets confusing for people to keep track of the various websites. So you see on the screen, that is a link for partners that goes to our PHE planning page, and then the Health First Colorado page that I mentioned for members. The site that we have created and will be promoting is keepcocovered.com. So keepcocovered.com. And that is where you will see a lot of our messaging pointing to. And once you're at that keepcocovered.com site, basically there's going to be two options. If you're a stakeholder, you go here. If you are a member, you go here, and then it will take you to these respective web pages. like I said, we had a lot of back and forth as to what the best way to do this is, but we really landed on the notion of let's give folks just one web address to remember that hopefully is easier to remember than some of those that you see on the screen. But at any rate, so some of the communication campaigns include the Update Your Address campaign that includes a toolkit, and also our renewal education campaign. The Update Your Address has been going on for some time, just because it's obviously critically important that we're able to reach members with those packets. And we're also trying to encourage folks to opt in for electronic messaging wherever they can, phone calls, text messages, as well as emails, just because it is fast and efficient. We also have the renewal education campaign and Take Action on Your Renewal toolkit, pardon me, that provides member messaging about renewals starting up and the need to take action when their time to renew comes along. It includes member FAQs, videos about the renewals, kind of walks you through that process, and really to help Coloradans know what their coverage options are. Like I said, we estimate that probably more than 325,000 people will no longer qualify for Medicaid or CHIP. And so what we're working with is Connect for Health Colorado, the Division of Insurance, to help provide other links and resources where those folks who are no longer eligible can still hopefully find coverage, whether it's through perhaps a spouse's employer-sponsored plan, or if someone has turned 65 during the course of the pandemic, they will likely be eligible for Medicaid or Medicare now. Also, Connect for Health Colorado, subsidies available there. And C4, or Connect for Health Colorado, they are also going to be extending their special enrollment period. That hasn't officially happened yet. It'll probably officially take place in early May, when all of the final T's are crossed and the I's are dotted. But they're going to extend what has been a 60-day special enrollment period when there's a qualifying event, such as losing your Medicaid coverage, to enroll in a plan. They're going to be extending that for a full year. But what we're really trying to push is that we don't want people to wait for a period of time, creating a gap in their healthcare coverage. As this group well knows, so many bankruptcies are the result of medical debt. And we're really trying to encourage folks to think ahead, plan ahead, if they have if they think they may no longer be eligible because their income has gone up or other circumstances have arisen, that they may lose their coverage, that they start doing their homework now. If we could go to the next slide, please.
Mark, before you move on, a question that I'm getting every time this is talked about, and I have not personally tried this in several years, is people who have a Peak account, but they can't remember their stuff, and they can't, the process to fix that is way too complicated. So they're just giving up and saying, I'll just do paper. Has that been made easier? Because often people are doing this on weekends or evenings when they don't have time, they don't have the ability to call, or they're doing it on a break at work and they can't sit on the phone. Has that been made easier?
That is a great question that frankly I had not heard about. So, and that's my own ignorance. Let me find out about that and circle back with the group to see what's up. I know that the Peak inbox is there to help people, and the Peak call center is there to help people with passwords, updating, changing, etc.
Yeah.
But you make a really important point about the after hours options. And
if there was a self-service that didn't have like overly restrictive security, that would be helpful, because often someone is, I mean, I know I have someone coming over Saturday for me to help them with it. And so if they have to send something and wait for a response, it's going to probably be 2-3 weeks before we can get together again. And then, you know, like that just causes problems for a lot of, for the people that tend to have the most problems with that.
That's great insight. Thank you for that. And it's that kind of detail that I am not aware of personally, but it's that kind of thing. And we experienced it with COVID as well with, vaccine information. It's that kind of on the ground feedback that is critically helpful. So thank you for flagging that. And I will raise that and see what we can.
And I'll tell you after Saturday how hard I think it is.
Okay, good. Yes, please do. Please do. I appreciate it. So I mentioned earlier the keepcocovered.com site. This is an example, the public health emergency planning page for stakeholders and community partners. Once you go to the Keep CO Covered page and you click on the resource for stakeholders and community partners, it will take you to this PHE planning page, as we refer to it. And it is loaded with resources, both all of those toolkits I referenced earlier that are downloadable for text messaging, for flyers, for newsletter content. There is a lot of information there. We also have this community partner webinar coming up on the 26th of April that I would encourage anyone who is interested in joining it to please do so, so that you can learn more about the resources that are available. And really, that's about all I have. If we go to the next slide, this slide will have my email on it, along with my colleague, Allison Ledden. And Allison has been doing a yeoman's job on really developing a lot of this content and helping us think through our communication strategies. So please do not hesitate to reach out to Allison or myself with any kinds of questions that you may have. And with that, if anybody does have questions, I'm happy to answer them to the best of my ability.
There was one in the chat that I answered, which is there are a lot, and the question was specific to people with IDD that have been put on buy-in even when they're not really earning enough. But there are a lot of people that are in the wrong category. And my understanding is that when they do their redetermination, they should be switched to the right category. Like we have people in buy-in that probably shouldn't be. We have people on MAGI that should be on buy-in. And so the redetermination should sort that out.
Good. Let me confirm that. Again, and I apologize for my ignorance. It's a level of detail that I'm not 100% clear on, and so I don't want to speculate and provide anyone with misinformation. All right. And with that, I will pass that along to Colin, I believe.
Yep. Thank you, Mark. And I would be remiss not to take just one moment. Actually, on Tuesday of this week, the 14th, marked 3 years since many of us at the department were sent home. And then actually that following week, so next week, will be the 3-year anniversary of OCL's first webinar. So time flies, I suppose, but really, I think just amazing amount of work that has gone into keeping people informed. Julie, I want to thank you. I want to thank everyone else on the call today. So many of you, I recognize many of the names, sharing information with your networks, making sure people are aware of what's going on. It I think really speaks to just how engaged and thoughtful and collaborative this community is. So thank you all for that. I think Mark talking about the end of the PHE just made me remember that as a 3-year date that's coming up. So if we can go to the next slide, please. I see, SB, that you had a comment back to Julie. I admittedly, I'm not sure if I understand either, so I'll wait for some follow-up to maybe see if I can answer at the end of the webinar, or at least direct you to the right place. But with that, if we could go to the next slide. There's another milestone that I want to reflect on and celebrate. And so the home and community-based settings final rule here in Colorado is implemented. The federal rule, as it exists here in Colorado, protects members' rights. It requires community integration. It protects private communication with others. It allows for control over personal resources. It allows for informed choice, focuses on privacy, dignity, and respect. It's freedom from coercion and restraint. It allows for individuals to have their own initiatives, autonomy, and freedom over one's own schedule. It allows for lockable doors in bedrooms and bathrooms. It allows for physical accessibility, choice of a roommate, being able to furnish and decorate one's bedroom. I list all of those things because previously those were not codified as well as they needed to be in Colorado. And so since that federal rule came out also in March of 2014, March seems to be a month with a lot of anniversaries, the department and the Centers for Medicare and Medicaid have worked together to extend the timeline that we have, but really to focus in on getting a lot of these things done, making sure that we have compliance with our settings across all of those settings, whether it be adult day or day treatment, day habilitation, to assisted livings, to host homes, to group homes. And so what had happened is we extended from 5 years originally to 8 years to 9 years. And really that transition period actually ends tomorrow. As of tomorrow, we will no longer be in that transitional period. And so we did, as you may recall from some conversations at the end of last year, we did do one last extension for certain providers that met a very specific criteria. In particular, that criteria focused on organizations rather, that were having issues in finding direct care workers or workers in general to help support that transitional period. And so right now, we are, again, just 1 day away. And so we've submitted our corrective action plan. We've allowed for that transitional period, which again ends tomorrow. But in big news, just 2 days ago on the 14th, we became the first state in the country to receive approval for our corrective action, meaning that we are ready to move forward. We are in compliance, and a huge milestone. This has been 9 years of work for providers, for our community, and really for codifying and acknowledging, respecting, and putting into regulation those rights for all people within our services. So a big thing to celebrate. If we could go to the next slide. Thank you. So wanted to give some numbers. So we are actually 98% compliant. These covered, we're 98% of settings have been covered by this transition period, and they're verified as compliant. We've made a huge amount of progress towards statewide compliance with this federal rule. This again reflects enormous contributions made by stakeholders, members, advocates, others that have participated in the rulemaking process, but I think more broadly, the thought process behind what this looks like in Colorado. So want to thank everyone there. Want to thank our partners at CDPHE for this work. We have really, I think, improved many lives through what we've done here, and trying to make sure that person-centeredness is truly at the core of the services that are provided, the case management that overlays that system. And so this doesn't mean that we're done. We have some additional settings that we're still working on coming into full compliance. They've gotten a reprieve. They've got far enough along. But we're going to also be developing an ongoing monitoring process for this. What we don't want to see is everyone rush into compliance and then things start to backslide or things start to slip into, maybe not exactly what we had intended or what we had hoped for with the final settings rule. And again, that person-centeredness being at the center of what we do. So all of these efforts will ensure that we lock in those important rights and protections for members. But again, I think a moment to celebrate. So wanted to thank you all for that work and give you an update on what we're doing here. And I'll take just a second to see if there are any questions on this before I turn it over to Candace. And Julie, I appreciate the shout out for remembering dates. Yeah, some dates just stick with you with CMS stuff. So that's I'm not sure if that's a blessing or a curse, but with that, I'm going to turn it over to Candace, who will talk a little bit more about private duty nursing.
Thank you so much, Colin. And I just want to say again, congratulations to everybody on the final settings rule implementation. And that is a huge accomplishment. It was a huge lift and a lot of work for everybody. So congratulations. It's very exciting. Next slide, please. All right, so my name is Candace Bailey, and I am the HCBS Division Director within the Office of Community Living, and I'm going to provide just a quick little update on private duty nursing benefits. Just kind of let everybody know, just a reminder, the PHE End benefits moved to the Office of Community Living back in September, which is why you are getting an update now during our OCL webinars. So just want to remind everybody that we have an administrative approval process, which meant that all prior authorization requests were approved through April 2nd. This is scheduled still to end on April 2nd. All determinations, so for all of the information that's been coming in during this approval process, the providers have continued to submit documentation, paperwork, requests. All that information has been taken in, and everybody has, all the cases have been reviewed, and determinations are starting to be made this month. And all of the determinations will be finished and out before the end of March. And so there was actually the first set of letters that were mailed to members on March 9th. So that was last week. So folks should have received, those were approval letters. Those are very exciting. We always like to send those. And then all of those, they will be going out in batches throughout the rest of this month. So everybody will receive a determination letter on their request or their provider's request for their services before April 2nd. We're continuing to work with providers to ensure appropriate services are authorized. So we want to make sure that providers are requesting the appropriate level, hours, everything that an individual needs. And then if anybody has any specific questions about private duty nursing, there's a home health at state.co.us email box that is monitored by multiple department staff. I actually get copies of all of those emails as well. So if you have any questions, please feel free to reach out to us directly, and we are happy to talk through any of it with you. So just a quick little update on that. And are there any questions?
Candace, I'll just say it's important to know that if someone is denied or reduced, they would still, of course, have appeal rights and their services would continue during the appeal. So I just want people to understand that.
Thank you, Julie. That is really important. So if anybody's services are partially denied or fully denied, they will receive an appeal. They do have appeal rights, whether it's a full denial, partial denial, or a technical denial. So a technical denial would mean that we didn't receive the information that is necessary. Those all come with appeal rights, and services do continue during that entire time. So thank you, Julie.
Okay, I don't see any in the chat. I think we're back to Colin for budget and legislative update.
Yeah, thank you, Julie. And certainly I'd offer, if you have any thoughts on the legislative session or anything that you saw with JBC over the last couple of weeks, please jump in. So a couple updates. I think I have some good news over the next couple slides, so hold tight. The Joint Budget Committee last week voted to include some of the items that we had asked for, and then some. So we had, as a department, again, with very limited dollars and wanting to make sure that we were presenting, a balanced budget. The initial across the board increase was actually 0.5%. That was increased to 3%. The cool thing about this and the fact that it had gone up to 3% is that this 3% is actually going to be iterative to the additional rate increases that we had put forward around the base wage. So, for example, here in Denver, if you're a personal care worker, there was a 5.9% increase to make sure that you were able to go up for that. Or excuse me, that's not Denver, that's just the urban area. So it's 5.9%. So with this, it's actually going to be 8.9% of an increase to that particular service. So more to come on what exactly those rates look like, but it will be, I think, a big deal for many of those rates that either hadn't received that base wage because they don't have direct care workers, or maybe weren't included in the targeted rate increases, which we'll speak to here momentarily. So the other thing that we did was align the waivers, or align the non-medical transportation rates across waivers. So now all of the waivers, whether it be ED or EBD rather, or DD or SLS or BI, all of them have the same NMT rates. Previously and historically, the IDD rates had been lower. And then there was a vote by the JBC to increase group home rates by approximately 18%. We also have a set aside for a bill, it's House Bill 23-1228, for the nursing facility rate increase. That's the nursing facility innovation work that's been going on. And then fundings for providers to account for minimum wage changes. That's the base wage I was talking about. We're taking that from $15 to $15.75. And then in Denver from $15.87 to $17.29. So a pretty significant increase there. But overall, because that is iterative, I think that will be good news for many of our providers. It'll be good news for our members who use CDOS and members who use IHSS. All of that will impact them. We can go to the next slide. Thank you, Jen. So a couple things that were sort of different this year. The department in OCL in particular put forward a budget amendment. A budget amendment comes later than the normal cycle, what you're probably used to with the JBC and the hearings in December. But this was a request to address Department of Justice findings. These things were included early on in a lot of these conversations, but ultimately this was approved last week as well. And so this allows for really the big thing, community first choice, a huge deal that finally is approved. We've had the money to move that forward. Super excited to actually get that and move that forward. I know a lot of work, frankly, has gone into that over the last decade or so. So we're really excited there, but it also allows for additional support around our transition services. It looks at how we can diversify some of the services and really approach rapid reintegration into the community from nursing facilities or hospitals or other institutional settings. And then our 10 expanded respite services for children enrolled in the CHIRP and CES waivers to include skilled and therapeutic respite. So really excited about catching some of those children that historically maybe have fallen through the cracks because of that need and what has ultimately led to what we know is a lot of family and caregiver burnout there. And then case management redesign, the rates actually were raised pretty significantly by the Joint Budget Committee, which we're happy to see and certainly glad to be a part of. That was up to $149.17. And so obviously a huge step, a big step forward. It's not the last step. We're certainly not across the finish line. There is a lot of bills out there. There's a lot of money that are part of those bills. So the hard decisions will have to be made, but where we stand right now, we certainly are looking a lot better than maybe we did 2 weeks ago. And I think a lot of you who are active at the Capitol or active in talking to your legislators have been a part of that. So thank you. And more to come. We'll certainly keep people in the loop as we move closer and closer to the end of session in May. So, Julie, did you have anything that you wanted to add before we move on?
Yeah, there are a couple bills that are of interest to the disability community. House Bill 1197 is going to create a process to create some better regulations around host homes to resolve some of the problems we see in that world. That is being heard next week. House Bill 1200, it has two parts. One is to create a very small voucher pilot for mental health, and the other is to create a way for family members who have loved ones in a mental health system to be able to provide information. Of course, information is not shared unless there's a consent form, but often someone's in a hospital and there isn't a way to for information about what has worked and hasn't in the past to get around to someone. And Senate Bill 144 will be heard it's passed the Senate. It will be heard in the House the following week. That will create some guidelines to stop the discrimination against chronic pain patients by both pharmacies and physicians, and make sure that the doctors that prescribe opioids to people who have chronic pain are not persecuted. There are also a number of bills on disability access by Representative Ortiz that are in various stages. And there are also a number of bills to try and prevent eviction, some of which are disability specific and some of which are generic that are all also very important. CCDC has a list of all the bills we're following on our website. There are about 40 of them. So that's, and then the budget, the budget will get debated in the upcoming weeks, the last week of March and first week of April, I believe.
Great, thank you, Julie. So real quick, I know we're running short on time. If we could go to the next slide. Just a couple announcements on some surveys that we have. Speaking of respite, we have a respite care evaluation survey. We really want to understand what the gaps within the service are, what the barriers are for families to access respite is, especially coming into 3 years out from the COVID emergency. We know there is a lot of caregiver burnout, so we are really hoping that people will share their experience with this. If you could send it out to your networks, that would be fantastic. I also know it'll be coming from John Barry, and so if you could forward that email, that would be most appreciated. If we could go to the next slide, please. And as always, Max, on the links in the chat. The NMT survey, I believe this actually went out already. But again, another thing that is really when we do any type of broad survey, when we do our national core indicators, transportation is always near the top, if not at the top of respondents' sort of #1 biggest need or barrier to the community. So there's a lot of work going around on this. We're actually having conversations about trying to get TNCs involved. And so a great opportunity for people to share their thoughts about NMT here in Colorado. So please would also encourage you to share that with your networks. We could go to the next slide. I think we have maybe a minute or two for questions. So if anyone has a question for Julie, myself, or Amanda, anyone else on the phone, please let us know.
I don't see anything in the chat. I mean, through.
And I'm not sure, it looks like we maybe lost SB, so I'm not sure if she got that link. So we'll just keep an eye out for that. Or Julie, I'm not sure if you know who that is, but we can follow up if you do.
Okay.
Okay. Julie, do you want to handle the survey stuff? What does that mean?
You can, yeah, you can go ahead and do that. It's just a quick, well, I can go ahead. If you can drop the link. Oh, it's already in the chat. Just a very quick link in this to see if this is useful or not. So if it's not, we can fix it or do something differently. We definitely want to know what needs to be better. So if you can just, again, 60 seconds, and we'll even end, on time so that it won't go past 10:30 if you fill it out real quick. So please fill it out.
Yeah, exactly. Good call, Julie. Thank you. All right. Well, I think up next we have what we can look forward to in the coming months. So we have our ARPA quarterly update. Again, we're rotating ARPA and the regular OCL general updates. And so we're going to miss a month in April, and then we'll be back talking about ARPA in May, and then back to our regularly scheduled OCL updates in June. Max just put a very helpful link in there. If you have any suggestions, including but certainly not limited to, do you want someone from another agency to come? Do you want PHE to come chat about something? Those are things that we want to hear. We want to make this a valuable space for people to get that information, but also be able to interact with areas of interest that they may have. So please feel free to fill that out if you have a moment. And then last but not least, if we could go to the next slide, Jen. Here are all the ways to stay engaged. I probably on a weekly basis will get a forward from someone saying, how do I get them on the John Barry email list? Well, right there in the center is how you get on the John Barry email list, but also a lot of important links. Our memo series is there, so all of our informational operational memos. What I had talked about earlier around the end of the PHE in those services, that will be part of an informational memo that will go out here shortly. So worth keeping an eye on, worth putting a bookmark to a lot of those. And with that, Julie, anything else you'd like to add?
No, I just put John's email in the list because there's an R in the middle. It's john.r.barry@state.co.us.
Yes.
Because you can't really click on that if you haven't been able to download this. So no, nothing else. Thank you very much for showing up and participating. and get involved. There's enough to do. I tell people if they wanted to do HCPF meetings full time, there are enough meetings to do that. Even if it's just OCL meetings full time, there's enough to fill several people's schedules. So there's a lot going on, and the more those of us that use the system are involved, the better it is for everyone.
Yep, absolutely, absolutely agreed. Well, thank you, Julie, and everyone.
Thanks.
Drive safe out there if you're traveling. If not, stay warm, and thank you all. Have a great rest of the week.
Thanks, Colin.
Yep, thank you, Julie.